Good day everyone, I am Fernandez and you are here now in ADHD and Autism Awareness Campaign. This campaign will give you information about different aspects of ADHD and autism. Also, it gives some strategies on how to deal and interact with those people who has ADHD and autism.
I'm John Patrick de Guzman Santos, Bachelor of Physical Education, 3rd year, Section A. And let's talk about ADHD.
Hi, my name is Lesmin Paule, and we are going to talk about ADHD and autism. There are 51.1 million people in the world that has ADHD, and 1 of 34 boys and 1 out of 144 girls have autism in the world. Now let's find out what is all about ADHD and autism.
Hi, my name is Arjay Pedroso. I would like to inform you about ADHD and ASD are both conditions or disorder affect the central nervous system, which is responsible for movement, language, memory, and social and focusing skills.
Guys, my name is Mei Lichangco, and let me give you some idea about ADHD. ADHD awareness spans the entire month of October. It is an opportunity to everyone to increase the education and understanding of attention deficit hyperactivity disorder and decrease the stigma surrounding it.
Everyone, I'm Armeza. I'm going to inform you the treatment for autism.
So, hi guys, my name is Geofrey Ian Cabadsan. So, may in-interview lang po akong kaibigan ko na may sakit po siyang ADHD. Yung bata pa po kami, lagi po siyang napagalitan ng mama niya na mag-stay lang sa isang tabi. But, ang sakit niya ay hindi daw madali, sabi niya sa akin. Habang tumatanda daw siya, mas lalo niya nakokontrol yung sarili niya. Mas nagpo-focus na siya sa mga ginagawa niya. Kasi nagkakaroon na siya ng mindset about doon sa sakit niyang ADHD. So, yun lang po ang gusto kong masabi.
Hola everyone! So when it comes to ADHD, there are 3 types of it. It can be inattentive, hyperactive or impulsive, or combined. So when we say inattentive ADHD, it is a subtype of ADHD in which an individual manifests a limited attention span, distractibility, forgetfulness, or procrastination. However, the people with hyperactive or impulsive ADHD, they feel the need of constant movement. They do fidget, squirm, or struggle to stay fit. They do like acting like driving a motor or running excessively. And that is the hyperactive or impulsive ADHD. Furthermore, the combined ADHD tends to show up the predominantly inattentive and predominantly hyperactive or impulsive movement. Tends to show up also the 6 or more symptoms of ADHD. That's all. Thank you.
What is ADHD? Attention deficit or hyperactivity disorder.
ADHD is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behavior, may act without thinking about what the result will be, or be overly active.
What are the signs and symptoms of ADHD? Number 1.
Daydream a lot,
Number 2.
forget or lose things a lot,
Number 3.
squirm or fidget,
Number 4.
talk too much,
Number 5.
make careless mistakes or take
Number 6.
unnecessary risks,
Number 7.
have a hard time,
Number 8.
resisting temptation,
Number 9.
have trouble taking turns,
Number 10.
have difficulty getting along with others.
predominantly inattentive presentation, is a type of ADHD that is hard for the individual to organize or finish a task, to pay attention to details, or follow instructions.
Hyperactive, impulsive presentation.
Predominantly hyperactive, impulsive presentation. The person fidgets and talk a lot. It is hard to sit still for long, example, for a meal or while doing homework. The combined presentation. Symptoms of the above two types are equally present in the person.
Causes of ADHD. Scientists are studying causes and risk factor in an effort to find better ways to manage and reduce the chances of persons having ADHD. The causes and risk factors for ADHD are unknown, but current research shows that genetic plays an important role. Recent studies of twins links genes with ADHD.
Brain injury exposure to environmental. During pregnancy or at young age, alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Research does not support the popularly held views that ADHD is caused by eating too much sugar, watching too much television, parenting, or social and environmental factors such as poverty or family chaos. Of course, many things including these might make symptoms worse, especially in certain people, but the evidence is not strong enough to conclude that they are the main cause of ADHD.
The diagnosis of ADHD. Diagnosis. Deciding if a child has ADHD is a process with several steps. There's no single test to diagnose ADHD, and many other problems like anxiety, depression, sleep problems, and certain types of learning disabilities can have similar symptoms. One step of the process involves having a medical exam, including hearing and vision tests, to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents, teachers, and sometimes the child. The treatment of ADHD. Treatment. In most cases, ADHD is best treated with a combination of behavioral therapy and medication. For preschool-age children 4 to 5 years of age with ADHD, behavior therapy, particularly training for parents, is recommended at the first line of treatment before medication is tried. What works best can depend on the child and family. Good treatment plans will include close monitoring, follow-ups, and making changes if needed along the way. Managing symptoms of ADHD. Staying healthy. Being healthy is important for children and can be especially important for children with ADHD. In addition to behavioral therapy and medication, having a healthy lifestyle can make it easier for your child to deal with ADHD symptoms. Here are some healthy behaviors that may help. Developing healthy eating habits such as eating plenty of fruit, vegetables, and whole grains, and choosing lean protein sources. Participating in daily physical activity based on age, limiting the amount of daily screen time from TVs, computer, phones, and other electronics.
These are the teaching strategies for students with ADHD. Build a strong relationship with the child's parents. Ask about the child's strengths, weaknesses, interests, and achievements outside of the school. Educate fellow pupils. Establish effective seating arrangements. Establish rules and routines. Be simple, clear, and direct. Break things up. Allow extension. Reward good behavior. Make tasks interactive.
What is autism? Autism spectrum disorder, or ASD, is a developmental disability that can cause significant social, communication, and behavioral challenges. There is often nothing about how people with ASD look that sets them apart from other people. But people with ASD may communicate, interact, behave, and learn in ways that are different from most other people. The learning, thinking, and problem-solving abilities of people with ASD can range from gifted to severely challenged. Some people with ASD need a lot of help in their daily lives. Others need less.
Signs and symptoms of autism spectrum disorder. People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not want to change in their daily activities. Many people with ASD also have different ways of learning, paying attention, or reacting to things. Signs of ASD begin during early childhood and typically last throughout a person's life.
Aside from the signs and symptoms of autism, these are the diagnoses.
Diagnosing autism spectrum disorder can be difficult since there is no medical test, like a blood test. To diagnose the disorders, doctors look at the child's behavior and development to make a diagnosis.
However, these are the treatment for autism.
There is currently no cure for ASD. However, research showed that early intervention treatment services can improve a child development. Early intervention services help children from birth to 3 years old or 36 months learn important skills. Services can include therapy to help your child talk, walk, and interact with others. Therefore, it is important to talk to your child doctor as soon as possible if you think your child has ASD or other developmental problem. Even if your child has not been diagnosed with an ASD, he or she may be eligible for early intervention treatment services. The Individual with Disability Education Act external icon says that children under the age of 3 years or 36 months who are at risk of having developmental delays may be eligible for services. These services are provided through an early intervention system in your state. Through this system, you can ask for an evaluation. In addition, treatment for particular symptoms such as speech therapy for language delays, often for those not need to wait for a formal ASD diagnosis.
Now let's talk about the causes and risk factors of autism. The causes and risk factors of autism spectrum disorder. We do not know all of the causes of ASD. However, we have learned that there are many causes for multiple types of ASD. There may be different factors that make a child more likely to have ASD, including environmental, biologic, and genetic factors. These may include problems talking back and forth, working or playing with others, unusual interest in objects, need for sameness, great variation in abilities, under or overreaction to one or more of the 5 senses, repeated actions or body movements, unusual emotional reactions and expressions.